Thank you. This is a very good report, and I thank the rapporteur for her cooperation. I am pleased this report talks about better implementation of current directives. I also welcome calls for better inspection. There is no point in Member States paying lip service to implementation, as many do in the field of health and safety, and then quite often it is those very same Member States who call for more legislation, even if the scientific and medical evidence does not establish a risk. Where I believe we do need legislation, and we called for this in 2005, is to prevent the over 1 million needle stick injuries which affect healthcare workers each year across the EU. Imagine the horror if you are accidentally pricked by a needle and then have the horrendous wait to see if you have contracted a serious infection such as HIV or hepatitis B. The Commission must now heed our call and bring forward an amendment to the 2000 Biological Agents Directive. In some areas, of course, exchange of best practice is probably enough, and that is why I am pleased that my amendments on healthcare-acquired infections passed in committee. Infections like MRSA are not only serious for patients in hospital, but also for workers. Rates of infection vary considerably between Member States. The UK, for example, have a 10 times higher rate of infection than the Netherlands. We need to know why and how we can learn from best practice. That's why I called in one of my amendments, which passed in committee, for an EU code of good practice on healthcare-acquired infections, and to encourage the screening of all healthcare workers across the EU.